do we need to do Kegel exercises? This is a loaded question and an age-old question that I promise I'm going to answer, as well as dispel some of the most common other pelvic health myths that we hear all the time that are affecting people's ability to optimize their pelvic health. My name is Dr. Brooke Kolisiak, and I am a pelvic physical therapist who is passionate about helping people optimize their pelvic health. So let's take a step back and first find out, what is the pelvic floor? So here we have our lovely bony pelvis. And if we look at the bottom here, anything that's in red is muscle in the area. And it goes from the pubic bone in the front to the tailbone in the back. And it spans across our two sit bones. And it goes around our urethra, vagina, and anus. And this is a bowl of muscle on the bottom of our pelvis that helps to support our pelvic organs, and it is involved in bowel, bladder, and sexual function, as well as helping us maintain proper pressure and mechanics in our pelvic and abdominal cavity. So this is a really important group of muscles. And now a Kegel exercise is a contraction of those pelvic floor muscles. And it's just the generic name for it. I like to just refer to it as a pelvic floor muscle contraction. And that's where it is both a squeeze and a lift up and in. I think about kind of lifting the vagina up or sucking something up the vagina straw if I'm thinking about doing a pelvic floor muscle contraction or a Kegel exercise. So are Kegel exercises the end-all be-all when it comes to pelvic health issues? And the answer is simply no. That is not the case. Kegel exercises are a strengthening exercise for the pelvic floor. And unfortunately, many women and people in general are wrongfully told to just do Kegel exercises when they're dealing with pelvic pain, pelvic organ prolapse, bladder leakage, bowel issues. It's kind of this catch-all thing, like, oh, it's a pelvic issue, just do Kegel exercises. And unfortunately, that doesn't really work. And it doesn't really work when we think about it as it relates to other areas of the body. If you went and told your doctor that you're having shoulder pain and they said, just do some bicep curls, like, you'd look at them like they were crazy. But we unfortunately tell people all the time when they tell us that they're dealing with bladder leakage or pelvic pain or prolapse issues or heaviness issues, oh yeah, just do Kegel exercises and that'll be fine. But that's simply not the case. Many times people's pelvic floor muscles are too tight and tense. They're already overcontracted and not letting go well, and therefore not functioning well. And if we tell that person to keep doing contractions, that's simply not going to work well for them. So Kegel exercises are definitely not always the answer for a pelvic health issue. Another common myth that we often hear is that pelvic floor issues only happen to women. I'm here to tell you, everyone has a pelvis. Men, women, children, you name it, we have a pelvis. And that means we have pelvic floor muscles, and that means we can have issues with it. So here at our practice, we work with all individuals who are dealing with pelvic issues. Kids can be having bowel issues, constipation issues, bladder leakage issues, even pelvic pain issues. Men commonly have prostate issues, chronic prostatitis or pelvic pain issues, pain with sitting, as well as working with women who are dealing with pelvic heaviness, pelvic pain, bladder leakage, or bowel issues. Everyone has a pelvis, so everyone can have pelvic floor issues. This is not a female-only issue. Another common pelvic health myth that really pisses me off is that pelvic floor issues are an inevitable part of aging. That is straight BS. Yes, it may be common that as we get older, we start to see more issues like bladder leakage, pelvic organ prolapse, or pain with sex, but that does not mean it's normal. It does not mean that we are all marching back down the path to diapers. And there are several easy things that we can do to optimize our pelvic health over the years to make sure that we are not ending up with pelvic health issues in our 50s, 60s, 70s, or 80s. Oftentimes, it is best that we do start working on these things earlier on in life, like around the age that we're thinking about having kids or shortly after having kids. But many people don't start working on these issues until later on in their life, maybe when they're hitting menopause or perimenopause, or maybe even well past that time, and they can still make changes to make sure that they are optimizing their pelvic health and avoiding a life of dealing with pelvic floor issues. Another myth that drives me nuts is when people say, well, my doctor didn't ask me about it or tell me anything about it, so it must not be that important. Again, this is BS. Unfortunately, in our medical system today, physicians need to learn so many different things and get so much information tossed at them that they get very, very little to any education on pelvic floor issues, pelvic health, and menopausal health. And therefore, a lot of times, patients are left on their own to figure it out and to bring it up. So if you are dealing with pelvic health issues like bladder leakage, bowel issues, pelvic heaviness, pelvic pain, pain with sex, any of that stuff, you may be the one who has to bring it up. And if your medical provider is dismissing you and telling you that's a normal part of aging, or it's not that bad, like maybe when it gets worse, tell me about it and we'll consider doing surgery, or I don't deal with that issue, or everything looks normal to me, so it must be in your head. These are all common things that patients of mine have told me they have been told when they have been brave enough to bring up their pelvic health issues with their medical provider. And that really honestly breaks my heart, because too many people are being gaslit about the fact that there is nothing that can be done or needs to be done about their pelvic health issues, and that's simply not the case. And honestly, the earlier we can do something about a pelvic health issue, the faster we can get that recovery to happen, and the less time you spend suffering with the symptoms. One more myth that I really wish would go away is that myth that you can only deal with pelvic health issues when you're younger, that it's a lost cause when you're older. So many people, women especially, kind of wrongfully believe that this is something, pelvic physical therapy and pelvic health concerns are something, that you worry about during pregnancy and postpartum, but it's not anything that you can deal with later on in life. And that is simply false. I see many, many patients here at our clinic who don't necessarily have pelvic health issues until their 50s, 60s, or 70s. And a lot of them are like, is it too late? Can I do anything about this? Am I stuck with this? And the beauty is it's never too late. Our oldest patient to date was a 93-year-old woman who had bladder leakage and was going through 4 large pads a day because of her leakage, and was just sick of hemorrhaging her money on pads. So she came to us and we worked with her for a couple months, and she was so happy on her last day when she's like, I don't even feel like I need to be wearing a pad at all, versus going through 4 a day of large pads. So at any age, you can make a change on your pelvic health. So don't think it's too late for you. So hopefully I've answered the questions of, do you need a Kegel? And really, most of the time the answer is no, because the pelvic floor is supposed to be an automatic muscle that works as part of our core support system. But it is true there's times that it can end up with dysfunction, and we can end up having issues like bladder leakage, bowel issues, sexual issues, you name it. But that doesn't mean that the Kegel is the answer to it. Remember the shoulder analogy. If I have shoulder pain and my doctor tells me just to do a bicep curl, that really just doesn't make sense as medical advice. So why are we telling people who are dealing with pelvic pain, just do Kegel exercises? That is awful medical advice. Instead, you should be evaluated by a pelvic physical therapist to assess what's going on with the muscles in and around the pelvic area. It's not just about the pelvic floor. It's about your hip, your back, your abdominal muscles, how you're managing pressure in your system, how you're using those muscles in a coordinated fashion. We want to make sure all of them are working together. So hopefully this has dispelled some of the most common myths that you might have wondered about with the pelvic floor, and now you have a more definitive answer on whether or not Kegels are for you.